Well, in terms of whether you should seek an apprenticeship or university, I'm going to tell you, you need to do both. And the reason you do both is totally different. If you're going to go into healthcare management, you must get a degree. But you can also do, following your degree, you can get an internship because you can become into these management programs. Because when you finish university, you don't know anything about management, you've not managed people, you haven't managed a department or anything like that. So there are programs once you finish your training to get into those programs. They're similar to apprenticeships, but they're really not. They're internships for people who've gone to school, gotten a degree, but have no experience. So you want to get on a management training program, but in order to do that, you have to educate yourself. Where would you like to work? Who should I work for? Should I work for government? Should I work for private entities? Should I work for a non-for-profit organization? A lot of this has to do with your own motivation. I know people say working in the private sector is terrible, it's bad, it's money and it's greed. Everything we do is a business. The NHS is a business. The not-for-profit organizations are businesses as well. They just don't have shareholders, so they don't have to return whatever money they make, they put back in the organization, just like the NHS. Whatever money we make, we put back and invest in the organization. For-profit organizations or attorney shareholders that put in investments, so they expect a return on their investment. So, organization you can work for National Health Service, you can work for the Department of Health. You can work for the private sector as well. You can work in non-profit organizations. You can work for global organizations as well. So I tell people you have to be comfortable about where your values. If you want to work in a for-profit, that's perfectly fine. And if you don't, like I do, I don't believe in that making money off of people being sick and not being able to take care of themselves. So that's just a personal thing for me. So I tell you, pick your own area and have a good time at it. As a young person starting out for your career and you're unsure about what you want to do, as I said earlier, one of the things I would say is be very flexible, be very open to exploring different things. When I started out, as I said, I started out working in healthcare when I was 16, and I worked as what we called in America was called an orderly. And it's the equivalent of a healthcare assistant in the UK terminology. So I did that to try to fill out, well, do I really want to do hands-on care? It was fine doing that. I worked as a physiotherapy aide because I wanted to be a physical therapist. And it says, well, let me try that for 3 or 4 months. So I was lucky and I got a job for 3 months and I did that and I realized, that's not for me either. So just the flexibility is the key. Try different things. I didn't start, as I said, I didn't start off in management because I wanted to be a hands-on provider, but then I realized I tried these various things that weren't good for me. So do explore various opportunities. Go and look and see what you like and don't like. Try out many things. One of the things I actually did, I was a secretary once, just because I wanted to type and improve my skills using a typewriter. I know a typewriter is probably not what we use now, word processor and all these other kind of things. Now we use computers for everything. But it's all about being open and being flexible. And that's the strongest message I can give any young person is keep an open mind about experiences and try to experience as much in the healthcare space as you can. And then once you're comfortable, you decide that, I've tried a little bit, I tried this, I tried that, and I tried these various things, but this is something I really, really want to pursue, whether it's healthcare management or something in that realm, then you go for it. In terms of what I look for people just coming out of school for just basically to get your first job, you don't have any experience. I already know that. So we do look at your grades. We look at how well you've done in school. So we'll ask you, let us see your grades of subjects that you did well in. That's just an indicator of what your interests are. But it's also about how well you interview. Because for me, I want to see how you express yourself. I want to know what you're passionate about. I want to know you as an individual. Not just, well, here's how well I did in school. And you could be very, very smart. But it doesn't mean you can do my job. I want to know that it's more than just what you learn in school. It's how you apply what you learn. What common sense you have, what's been your experiences, the kind of things that you've been exposed to. People always want to know, how much money can I make? Is all of this worth it? Is aggravation, is it really worth it? The answer to that is yes. You can make, are you going to be rich overnight working in healthcare management? Probably not, because you don't go into healthcare management because you want to be rich. You know, are there people that are wealthy out there? Yes, in the private sector, big corporations, yes, and most people are never going to do that. So my rule of thumb, you should always aim for a salary 1.5 times your age. And I know a lot of people don't subscribe to that, but you take your age and you just put that is my minimum plus 1.5. That is where you're trying to go when you take your career, because that's your base of what you want to do where, and that's the value that you place on yourself, your education, and your experience. So healthcare, entry-level jobs, depending on which country you're in, but since we're here in the UK, we talk about the NHS, you can certainly expect to make, probably as an entry-level manager, somewhere between 40 and 50 to start with, and then it's upwards from there. If you were in the US, where I came from as a frontline manager, it depends. There are 50 states in America, as you very well know. Each state is very different. I spent the vast majority of my healthcare career in California. Wages are much higher, so it's really hard to say in America, because I think if you came in as an entry-level person into management, you probably are looking at, I don't know, somewhere between 30 and 50 US dollars, which is a little bit less, or about the same range of what you would come in the UK. And in America, your salaries can just go outrageous. If you want to become a chief executive in America, your salaries can go extremely high, 500,000 K up to 700,000 K in the US. Here in the UK, if you want to become an NHS and work in the NHS, some of the extreme salaries at the very top are 250 to 300,000 K. But that means a lot of experience, big organizations. You've had to have worked as a chief executive somewhere else. So those are the ultimate extreme side. But the people like myself, you do fairly well. So you do a good salary and you have a nice career at the end of the day. Now, as a young person, you're always trying to figure out, how can I get work experience? What do I need to do in order to get a job in your organization or an organization like yours? A number of organizations, particularly here in the UK, have apprenticeship programs, and so that's one way to come in as an apprentice. You don't have to have a lot of experience. The whole point of an apprenticeship program is to take you where you are, expose you to the things that you will be exposed to, and let you learn from seeing other people, because you do actually get a real assignment. You get to engage with people at different levels of an organization. Some of the apprenticeships are paid, some are not paid. I think volunteer work is a good way to get into organizations. I know people hate the word volunteer because I'm young and I can get payment. But what you get, you gain the experience. So it's not always about money, it's about what you gain as experience. Because when you're applying to university, they look at what you've done for experience. If you're going to go into any chosen field, they want to know if you have any passion for it. Have you had any exposure to it? So doing volunteer work is actually a good thing. We have an apprenticeship program here at our hospital, and a lot of places have apprenticeship programs. So I would say look for a program. And if you have members or families or friends that work in healthcare, talk to them, because they can actually get you into an organization. I think there's this whole thing of where a lot of parents get to bring your child or daughter or son to work one day. So whatever their chosen profession is, you can come in and see what it's like. And we do that very often. I would tell young people to go into organizations, ask questions. You can make appointments to see people like me. If you know, even you don't have to even know them, you can say, well, I read about your organization. Would you allow me to come in and talk to you? Could you spend some time telling me about your organization, telling me about what it is that you do? Maybe this is right for you. You may find out, something, oh gosh, I really don't want to do that. Or I'm very excited about doing that. It's about making contact. And it's really hard when you're 15, 16, 17, and you're going into this whole adult world about your future and how do you make contacts. Well, a lot of your contact is through families and friends, people that your parents know, because all parents know someone who knows someone that works in healthcare in some level, even because they don't have to be in management. They could be a nurse, they could be a worker, but they will know how to get you in touch with some manager if you want to pursue a career in healthcare management. What do I like most about my role? And like all jobs, they're good. It's good days and bad days, but I have to tell you, I've been in healthcare for over 30 years, and I can't imagine having done anything else. Healthcare management is one of these things. I don't have children, but I got my need for being parental out doing healthcare management, because the one thing people don't tell you, when you're working in healthcare management, you have to deal with every person as an individual, and you have to understand what motivates them. Very much like if you're a parent, your children respond to different stimulus in the environment or different commands. It's the same thing at work. Yes, there are rules, yes, there are policies that people need to abide by, but there's still individuals that come at work with their own experience and their own set of values, and you have to find a way to make all of that fit within your healthcare environment and what you're trying to get accomplished. So I enjoy what I do. I wouldn't have done it for as long as I have. I did enjoy it. I feel very much appreciated by the teams that I work with and support. When I see a smile on a child's face, or a smile on a parent's face, or even an adult, an elderly adult, where something that I did made a difference, then I feel good about what it is that I've done and the career that I've chosen.